Good morning. You're listening to Insurance Matchmaking, your path to health, life, and Medicare coverage with Matt Libby Insurance. And now, sharing his knowledge, here's your host, Matt Libby.
All right. Well, welcome back to Insurance Matchmaking. Elijah's joining me again today. We're going to address some questions a lot of seniors have asked. A couple things I don't remember if I mentioned it last week, but one of the things was the cost for next year. They're still not official out yet. I did double check. Some of the numbers I've been given have maybe been wrong on. And again, don't know if they're the right numbers, but the estimate for the Part B premium, which is currently $185, is going to be $206.50. And then, like I said, that's not set in stone, but that's what everybody's anticipating. And we've found in the past that we can't always go on what everybody's anticipating. We had a couple of years back, there was quite a bit of difference in the price. So we'll see. The numbers that I have been saying, what the expected for the Part B deductible going from $257 to $288. And the other number that I had, and I think I was pretty close, the Part A deductible is currently $1,676, and it's expected to go to $1,716. So we'll see when it all settles out. Those numbers are not set in stone, so be prepared for. But they're going to be close. They're usually pretty close every year. So I just kind of wanted to get that out there. We're going to talk about some Medicare things today because we are in the middle of the Medicare enrollment season. But 1 week from today, as you're listening on the radio, will be November 1st, and that will actually kick off the Affordable Care Act enrollment. So then we'll start having rates and things like that to be able to tell people. Government shutdown has not ended yet as we're speaking today, so who knows what those subsidies will be. And that's the thing. We really don't. We can only go on what the prices are today, and that can kind of give you an idea. Most people are expecting those costs to go up a little bit. I say a little bit. I don't think they're going to go up big, huge jumps for those in the lower and middle income, but you are going to get a little bit less. I'm thinking somebody who might be paying zero, especially if they're paying zero for a silver plan, that I don't think there's going to be any or very few people who will have zero premium on a silver plan, but it might go to $50. I don't see it going from zero to $250. I don't think there's going to be that big a jump, but some of the scare tactics online will say that, but I don't think it's going to be that much. And as always, I've mentioned, we do offer MediShare, the Christian Health Sharing Program, as an alternative because there's those people at higher income are not going to, if they don't extend the tax credits, the expanded tax credits, you won't qualify for a subsidy. So that's going to be something to look at. And then also we do have the short-term plans. We are able to do those 3-year at a time short terms. And I always follow that up with, you are not locked into having that plan for 3 years. You can still cancel at any time. But the beauty is year 2 and 3, you don't have to go through the health screening to renew that policy. So anyway, we're going to get into some of these questions in no particular order. We made a list, and so I kind of researched, kind of come up with the answers, but we don't have to go in order, Elijah. If there's one that you think, yeah, that one didn't come up first, but that's the first question I want to ask, I'm fine.
Okay. Yeah, and again, these are questions that are frequently asked by seniors, and so we're going to go through those. So, Matt, why work with a Medicare agent?
Well, one of the things is it can be confusing. If you've looked at Medicare at all, it's probably pretty confusing. But we go through a lot of training to be able to help you make an informed decision, and we can help you be more informed in making your decision. Just kind of, and that's the approach I generally take. It's kind of an educational approach. I had somebody in the office this week and brand new to Medicare, had her Medicare card, got that. She had one hurdle accomplished, but it was like, so I have a little slideshow PowerPoint presentation that I use for my Welcome to Medicare, Medicare 101 workshops. And so I went through that, tried to go through it a little quicker because that's why I like to do those workshops. If to do that presentation right, it takes about an hour. Then we get into, enrolling you in a plan. And I don't really have an hour to spend with everybody just teaching them Medicare now. So it's great that, if we can get that. But that's one of the reasons to do the work with an agent. Don't just go online and say, oh, okay, I'll do this, and pick the lowest cost plan, because lowest cost is not always your best friend.
Speaking of lowest cost, are Medicare Advantage plans really free?
Yeah, that's a big one there. They're not free. In fact, actually, if you're talking to a reputable agent, we're forbidden to use the word free when we describe a Medicare plan. So if somebody's talking to you or you see an ad talking about the free stuff, that's probably not the person you want to talk to. Now, there are $0 premium. That's how we have to state that. And people are like, how can you have a $0 premium? Well, if you're familiar with the Affordable Care Act, you have tax credits that subsidize your plans. The Medicare Advantage plans are also subsidized. So are the Part D drug plans to an extent are subsidized. So the insurance carriers will offer a low premium or no premium plan because they're still getting paid by CMS to provide that plan. So they're not free, but there's a lot of things that you don't have a charge for. Of course, and then when it comes to Medicare, you have the Part A, which is your hospital insurance. If you've worked your 40 quarters, you qualify for Social Security, that does not have a premium. So so we're not supposed to say free, but Part A is as at no cost if you have the work the number of years of working. Part B, which is all your other health care, because Medicare is A and B, Part B does have a premium. It's not free, and you have a deductible, and after that deductible, it pays 80%. So that's why we say you don't want just Medicare. So, yeah, they're not free, but there are a lot of things that are low cost. And, again, we help you find the one that's going to fit you.
So speaking of Medicare Advantage plans, we had a senior ask, so if they're not free, why are agents pushing Medicare Advantage plans?
Yeah, and they're the right plan for a lot of people, but some agents push Medicare Advantage plans because the commission's higher. And it's plain and simple. That's why you see those advertised on TV. The big call centers, again, they're not doing that education approach that I do with individual clients. They need to get your Medicare number. They need to know your zip code so they can figure out what plans are available for you, and they're pitching you a Medicare Advantage immediately because that's where the commissions are. And of course, they work in a call center. They have quotas to meet, and that's what they're told to sell the Medicare Advantage. Sometimes I wonder some of these call centers if they even know how to enroll somebody in a Medicare supplement. But Medicare supplement is going to cost you more, but it actually, as an agent, kind of pays us less. When you're brand new to Medicare, we get paid double for a year's commission. It's doubled when you're brand new to Medicare on an Advantage plan. It's not doubled on a Medicare supplement. We do get a commission on it, but yeah, it's just and you don't have to change the plans unless they change. If the plan goes away but that's why we have this annual enrollment period is to review those plans and look at them. But it's just there's no health questions.
Okay. Speaking of Medicare Advantage, what's the difference between Medicare Advantage versus regular Medicare?
Okay, so the difference on Medicare Advantage and regular Medicare, everybody has to get their Parts A and B to have any Medicare coverage, but the Medicare Advantage plan combines those benefits of A and B into a health plan, just like whatever health plan you might have prior to Medicare. You might be on an ACA Affordable Care Act plan. You might have a short-term plan. You might have a employer group plan. That Medicare Advantage is going to work like those health plans. But the big difference is Medicare is not paying for your health care anymore. They're paying for your health plan. So when you go to the doctor and you get your bills, they're paid by that Medicare Advantage plan instead of Medicare. And you do have networks that you wouldn't have with original Medicare.
And then another question that we've had pull up is, what are some common misconceptions about Medicare?
Common misconceptions is it covers everything. It doesn't cost anything. The other one, and I think it may be one of the questions of kind of combining a couple questions, is it doesn't come about automatic when you turn 65. If you're drawing Social Security, it will come to you automatically because you're already in the system. So Social Security already enrolls you. But a lot of people think, I'm turning 65, I'm going to have Medicare. All my health care is going to be free now. And again, nothing's free. But you are going to have the Part B premium. You're going to have coinsurance, which is the 20% that you pay after Medicare pays. They're 80% once you've met that deductible. The danger of having just Medicare is Medicare doesn't have a maximum out of pocket. So that's why we always say you need something to go along with Medicare. And I've got some people, I don't want to pay for a Medicare supplement. Okay, then get a Medicare Advantage. It's better than nothing. And the reason I say that is as long as if you can find doctors who will take your Medicare Advantage plan, that's a great plan. Now, you can drop that plan any year during the annual enrollment period and just go back to regular Medicare. And the easiest way to do that is you select a drug plan, and then that drug plan will take the place of your Advantage plan. And because you need to have the drug plan, because there is a late enrollment penalty if you don't get your Part D when you're first eligible. So that's why it makes sense. If you're not going to use the benefit, you basically, I don't need anything, I don't go to the doctor. Well, you don't want to have late enrollment penalties. Get a zero premium Medicare Advantage plan that includes your drug coverage. You don't have to. There's nothing that says you have to use it. But if you do have to go to the doctor, you do want to you want to have something that the doctor will accept.
And then, so here's one really big question we have. What are some of the biggest mistakes seniors make when enrolling in Medicare?
Right. And like I say, I kind of combined that another question, but one of the biggest ones is they're thinking it's automatic, so they don't do anything. That's probably the biggest mistake. The other one, it's a big mistake. I don't know if it's totally common, but I have encountered it, is people who have an Affordable Care Act plan and they have a zero premium, or, their premium is much less than that Part B premium. And they're thinking, why do I need to pay this Part B premium when I'm paying next to nothing for this Blue Cross plan that I have through the marketplace? And it's like, well, because remember, those plans are subsidized. And when you turn 65 and are eligible for Medicare, that subsidy ends. So that plan that you think is zero or less than $100 is now going to be $1,600 to $2,000. That $185, or what did I say? I think $206.50 next year is much more affordable than having to pay full price for your ACA plan. To me, that's one of the biggest mistakes I'm seeing recently, or it's a big mistake I've seen some make. It's maybe not. I say it may not be the. If you're making that mistake, that's the biggest mistake. I don't think it's the most common mistake, but that's the biggest mistake you can make if you're on a Affordable Care Act plan and don't get Medicare because you think it's going to cost you more than your ACA plan. Okay.
And speaking as an agent, what's one piece of advice for picking a Medicare plan?
Right. Yeah, I think I kind of alluded to this also in another answer, is don't go for the lowest cost. It may look very attractive, and I say lowest cost, that lowest premium. It especially comes into play with the drug plans. There was a zero premium drug plan last year. That plan, if you have it, you know which plan I'm talking about. It will be $3.60 this year. Still very affordable. But there is another plan from another provider that is a zero premium. But that zero premium plan may not be the right plan for you. The one I mentioned, it has a $615 Part D deductible. If you have a brand name drug, that's probably not necessarily, or you have several expensive drugs, that's probably not going to be the right plan for you. It's so counterintuitive. I worked with a client just yesterday that it still made sense to get a drug plan that's over $100 a month because of the way, and that plan didn't have a deductible. She has one prescription. So this way she got that plan, and then it's going to cost her like $48 a month each month. She's going to have that premium. So basically it's going to cost her like $150. If she went with a lower cost plan that's priced around $50, she still was going to have to come up with the deductible of over $200 just to get a 1 month prescription on it, and had to do that for like 3 months before she satisfied the deductible. So, all right, well, we're actually on the break here, and we'll be right back after some commercials.
Tri-Lite, the people who bring you better internet, are now bringing you better wireless. Introducing Tri-Lite Mobile, a new wireless service for our area. Enjoy nationwide coverage, the freedom to bring your own device, and budget-friendly plans, all backed by the local team you know and trust. Right now, when you sign up or upgrade your internet service, you'll get your first line free. Ask about Tri-Lite Mobile today. Call 833-847-0824 or visit trilite.net. Some restrictions may apply.
The 29th annual Cooking on the Square, Friday, October 31st, presented by the Willow Point Group, Baird Private Wealth Management. A huge thank you to all our sponsors who make this event possible, including Truist Bank, Averett Express, Cookeville Ford, State Representative Ryan Williams, Cookeville Regional Medical Center, the Realty Firm, Tier 1, State Senator Paul Bailey, and Putnam County elected officials. Tickets are on sale now at local banks, the Habitat Office, Habitat Restore, or uchabitat.org.
And now, back to Insurance Matchmaking with Matt Libby Insurance.
All right, and we are back. Please support our advertisers so we can keep on the air.
So, earlier before the break, we were just talking about, why choose a plan that might have a higher premium than another. So, Matt, help me understand what all goes into Medicare costs.
All right, so there's always a premium. And again, the premium might be zero, but there's always a premium. And then you have copays, and then you have what's called coinsurance. People get those a little confused, but they don't usually confuse copays, but everybody, what the heck is coinsurance? Coinsurance is that percentage generally, like if you have a 70-30 plan, an 80-20 plan, that 30 or 20% that you pay, that's your coinsurance. So now, some Medicare Advantage plans, well, let me cover one of them. And then you have deductibles and maximum out-of-pockets. And a lot of people will call the maximum out-of-pocket on their Advantage plan their deductible. Well, deductible is what you pay before the insurance company pays anything. So generally, plans, and a lot of Medicare Advantage plans don't have a deductible. And I qualify that is generally, most of them do not have a deductible for health care. There are some plans that have added that in this year, and pretty much every one of them out there has added in a deductible for the Part D. And I've explained that on previous programs, so you can go back to Insurance Matchmaking and listen to some of the previous shows and get into that. But the costs, or I was talking about the maximum out of pocket. So you have those copays and coinsurance, and then when your share hits a certain amount, you hit that maximum out of pocket. And then after that, the insurance company pays 100% of the cost. So I understand how people kind of conflate that with a deductible. But deductible, you're sharing costs with the insurance company. Maximum out of pocket, you're not sharing the cost anymore. They're covering 100%. So those are some of the different costs. And that's what I say, sometimes looking at the monthly premium or the lowest premium can cost you more. That's the same thing if we've talked about the give back plans. They work great. If you hardly ever go to the doctor, they're a great option to put money back in your pocket. We have one plan that currently is almost paying what the Part B premium is this year. It's like $184.50 or $184.30. It's kind of a weird, but that they'll pay. And again, it's not that plan is not in Putnam County, but it is in surrounding areas. But I'm just using that as an example that you can have a $1 Part B give back, and what's the point in that, right? But all the way up to basically $185. That goes back into your Social Security check. And if you're not drawing Social Security yet, but you're on Medicare, it still will pay the portion of your Part B premium. They still send the money to Social Security to pay that. So you don't have to be drawing. But if you're drawing Social Security and you get a Part B give back plan, you will see your check go up. Now, the downside of those plans, they don't have as much benefits as some of the other plans. Some of them don't offer any dental, or they don't offer those over-the-counter benefits. And their maximum out-of-pocket and hospital copays are generally going to be higher. And that's why, and we always advise people on a Medicare Advantage to have a hospital indemnity plan, and probably cancer coverage too, to guard against those high out-of-pocket costs. And that's what I like about some of those give back plans is you can get that extra coverage and not worry about hospital and max out of pocket at all, and still have some money going back in your check even after you're paying a small premium for one of those cancer plans. So those are kind of the main costs. You do, like I said, you have the Part B premium. Everybody has a Part B premium. Currently, it's $185. If you are a single individual and your adjusted gross income 2 years ago, Social Security looks back 2 years, was over $106,000, you're going to have a surcharge, and there's 3 other levels depending on your income. Now, the good news there is if you're married and you're filing jointly, then that number doubles. So it's 212, not 106 as the cutoff. So whether your spouse works or not, if you're married and you're filing jointly, It's based on your total income, and it doesn't matter if your spouse is not on Medicare. It's just that's your household cost is how that works. So those are the ones. Everybody has that Part B premium. Some people have that infamous IRMA surcharge. And then those of extremely low income, they have the Part B premium, but if they under a certain income level, the state through the in our case Tennessee through the TennCare system, through the state Medicaid system, will pay that Part B premium. So everybody has the premium. Some people do get it subsidized. Did I answer all you had there? I know
very
that
thorough.
question was you wanted the answer on it, so it's like, how did I answer it sufficiently for you to know that our listeners I answered it sufficiently for?
So what I'm getting out of that, Matt, is what you recommend: Medicare Advantage, Medicare Supplement, different ancillary products. You determine that based on each individual you speak with.
Yes, it's very it's so specific. It's per person. I don't care if I got a married couple sitting in front of me. I'm not and I say it this way: I'm not pitching the same plan to both of them. Now I may, and even with like a cancer plan or the hospital indemnity plans, I've got one plan that's kind of maybe the most affordable with great benefits. The other spouse may not qualify for that plan based on health issues. I may have one spouse on a Medicare supplement and the other spouse on a Medicare Advantage, or they both have an Advantage but they don't have the same one. And the drug plans especially, I don't, if they're both on, a blood pressure and cholesterol or thyroid and blood pressure, yeah, they probably have the same drug plan because it's going to be very cheap, and they usually use the same pharmacy. But you have one person who's diabetic, taking cholesterol drugs, blood pressure medications, and the other spouse takes lisinopril, which is like a $2 blood pressure pill. Yeah, they can get that cheap drug plan, but their spouse may need that $106 drug plan. Or I think the highest one we got this year is $119. I say this year, I always do that. Whenever I'm talking, once I get into the AEP season, it's next year. When I say this year, I'm talking about 2026, and it's funny because I'll talk about last year, and I'm talking about the 2025 plans, which I've still been writing several 2025 plans of getting people who have just moved to our area or just turning 65. So I'm still writing 2025 plans when it comes to Medicare, but I look. And it's kind of again, that can make the appointment a little longer too, because I need to look at what's their plan like next year and sell them on that plan and say, okay, I'm going to enroll you in that plan. Some of the changes are like, hey, this year the plan doesn't have any drug deductible, but this is what the drug deductible will be next year. Or the premium next year is this, or the Part B give back. Some of those expenses. So I'm gonna have to make sure they know what the costs are on that plan next year. But I also have to let them know, hey, but they are different. You're getting it. It's going to start November 1st, November and December. It's going to be a little different.
So at Matt Libby Insurance, you really take the time to take a consultative approach and recommend the best thing.
Yeah. And of course, my problem is in that consultative approach sometimes can just get into visiting, because I visited with one client for about an hour yesterday. And all we did was change drug plans, and I probably could have been done in 15 minutes. But, I consider that part of the customer service or the customer experience, and that's why I have clients that call me back. A couple I just worked with this week. A lot of people, again, if I talk about the drug plans, we hate doing the drug plans. They're very time consuming. I have a couple I met with about 5 years ago. It was just before I think I maybe had moved here, but I was still working with the group in Knoxville. And so we had a meeting in Knoxville, and I met this couple. They were a referral from somebody in one of my B&I groups. They already had their Medicare supplement. They had just moved into Tennessee recently, and they already had their Medicare supplement, but they needed drug plans because they had moved. And so I helped them with their drug plans. Well, the other evening, I met with I spoke to them a couple times, and then we did an application for 2 Medicare supplements and one with adding a dental plan to it. So that's why I say I think it makes sense for me to take the time to spend the time with those clients, make sure they're getting what they need, and they call me back. I've got another client I've probably talked to about him. I've already talked to him this year. Lives down in Tullahoma. So if he's listening, he knows I'm talking about him. I talked to him when I was like brand new. I probably hadn't been in the health business with health markets any longer than Elijah's been with me. Called the lead, and he was considering whether he was going to go on the retire from his job and go on the marketplace. And at that time, he had an adult son that was like in college, and so it would have still been the three of them. And when we looked at the costs and based on the income and everything, it's like it made sense to not try to do the marketplace. So he decided to continue working for like another couple years. He kept my number. So he hasn't been my client for over 10 years, but I've been talking to him for over 10 years. And until like, I think it was like last year, he probably had seen like on a picture on my bit, but I had never seen what he looked like when we did like a Zoom meeting. It's like now we've kind of met face to face, but our face to face has only been online. We've never been in person with each other. And I've worked with this client, like I said, for over 10 years now. So yeah, sometimes I may take a little wait, as they say, as Elijah says, IPAs, and we're not talking about
a good beer,
Indian Pale Ale. We're talking about income producing activities, and those income producing activities are we're sitting down, as they used to say, knee to knee or belly to belly, and writing an application and selling something. There's a lot of times I talk to people that are my clients, and again, a couple of them I've talked with, you know what, just keep what you got. I don't think you need to change. And that still works for me. I'm still securing my income. I'm not selling something new, getting an increase in my income, but I'm keeping an income because they're still using the plan that I provided them.
So, you talked about somebody deciding to still work a couple of years or so. One question that a lot of seniors have is, will Medicare cover everything my employer plan does?
And that's a great question. Generally, yes, but things will be covered differently. So, and as I mentioned, preventative things, getting, for ladies, getting that pap smear, getting those mammograms, PSA tests for the guys, those. As a lot of people say, annual physical. It's really not an annual physical because it's funny. Medicare doesn't pay for that because that involves EKGs and chest X-rays and things like that, a complete physical, and that isn't covered as preventive. But that wellness check where they check, you get that exam, they take your blood pressure. They take your blood pressure, they do a blood test. All those are covered 100%, and that's pretty much across the board. Anything what's called a qualified health plan, so the marketplace plan, your employer plan, Medicare, they all have to cover those preventive things at no cost. Now, your cost to get, say, an MRI could be very different. You're just going to be covered. And so all those things will be covered, but the costs aren't necessarily going to be the same. And a lot of times you're going to find, though, depending on what kind of Medicare plan you have, your cost is going to be less than probably your employer plan. Most of the time, and this is one thing I tell people that, that was one thing. I had an appointment this week, and person's continuing to work past 65. I said it does make sense to go ahead and get the Part A of Medicare. You can go online and apply for just Part A. You're not drawing Social Security yet because you're still working. And you don't have to have Part B because you have that employer plan, and that is creditable for that you don't have a penalty because you didn't get that at 65. But that approximately $1,700 Part A deductible is what your hospital deductible is going to be, because a lot of times with group plans, even though they may be very generous when it comes to copays, they're still going to be $2,000 to $5,000 deductible for major things, especially like a hospitalization. That Part A deductible will be your deductible. So Medicare Part A will supplement your employer plan for like those hospital costs. You can get Part B when you're on, when you first go on Medicare. But generally, I'm saying if you're going to get Part B, I wouldn't keep your group plan because you're just kind of like double paying for insurance now. It makes more sense if you're going to do that. Now, again, you may have a younger spouse, so you need to keep your group plan. And that's why I say I wouldn't get Part B. And I always warn my clients or anybody that comes to one of my workshops, if you are contributing to a health savings account, don't get Part A, because there's tax penalties because that money comes out pre-tax and you're not authorized to contribute your personal contribution anymore once you're eligible for Medicare, which is at 65. Or again, if you don't draw Part A, the other warning on that is if you're going to continue to work and you are contributing to that HSA, be sure you cancel that HSA 6 months prior to you planning on retiring. Because when you do retire and you do apply for your Medicare, they will back up the effective date for Part A 6 months. I'm not sure exactly why they do that. It's probably because they can catch you on tax penalties. But the Part A will start 6 months earlier, or the earliest, is the date the month you turn 65. So if you delay it a few months, it'll still be the month you turn 65. But Part B will start when you leave that employer job. So it looks like we're out of time. And keep listening to Insurance Matchmaking. Go to insurancematchmaking.com or mattlibbyinsurance.com. You can go to work with Matt, work with Elijah, and set appointments with us. Remember, at Matt Libby Insurance, we cover you from head to toe. It doesn't have to cost you an arm and a leg.
You've been listening to Insurance Matchmaking with Matt Libby, your path to health, life, and Medicare coverage with Matt Libby Insurance.